Hi, my name is Amy, and this is my tracheostomy care video. To start off with, I'm going to go to the patient's room, close the curtain door, give them privacy, verify that I have the correct patient, introduce myself, and explain the procedure. And then we'll go ahead and sit the patient up in a high Fowler's position. And I'm going to wash my hands to open my sterile kit, like that. And then we'll pour in the soaking solution, the sterile soaking solution in one of the basins, and the other sterile solution in the second basin with the hydrogen peroxide mix to help get the crusties off. And then I'm also going to go ahead and place a drape underneath the patient so we don't get their gown dirty, and perform my hand hygiene and put on some clean gloves. And once I have my clean gloves on, I'll remove the oxygen source if the patient has one, and then remove the inner cannula very carefully and place it in the soaking solution. Let me just move this forward here so you can see it a little bit better. And then from here, we're going to go ahead and also remove the old dressing very carefully, holding the trach in place. And go ahead and throw your clean gloves and old dressing into the correct waste container. And go ahead and grab out our sterile gloves. And we want to make sure we grab the inside of the flaps to open them up. And grab the first glove by the cuff, and then the second glove we're going to go inside the cuff, avoiding touching the outside. Get our next hand in, and then pull down our cuff, and we can also do that with the other side, making sure not to touch the outside of the sterile gloves. From here, we're going to go ahead and clean the inner cannula. And we can also contaminate this hand and make it a clean glove if we want to pour over to make sure we get all the excess off. And then just make sure we get all the drippings off, all the water or sterile solution off, and go ahead and reinsert. And now this is a clean hand. I'm going to just insert that back and making sure I hold that very still. From here, we're going to go ahead and use the sterile swabs to clean around. We want to really make sure we're assessing the skin and making sure there's no infections. And we may want to use more than one to clean it up. And once it's all clean, we're going to use a sterile gauze to dry it off. And once that's dry, we're going to go ahead and place the sterile gauze underneath. Making sure we're very carefully doing this, not to dislodge. Okay. Now that we have that in place, we're going to go ahead and do the strings or the ties. Because I don't have anybody to help stabilize, I'm going to move that up. So if I don't have anybody to stabilize the trach, I'm going to go ahead and have keep the old ties on while I put the new ties on. They should come in your kit and be sterile as well. grab the other string, making sure we hold it in place where we put the string in. And make sure we keep holding that in place. And go ahead and we would tie this in place. Once we have our knot done, we're going to go ahead and tape the knot. Also put some gauze underneath to make sure we don't cause any pressure on the skin. Also, we're going to make sure we don't tie it too tight and just check that we can still fit about 1 finger to 2 fingers under. Also holding that stable. And then we'll cut off the old strings and remove those. And then remove our gloves, wash our hands, make sure our patient's doing okay, and put them back into a comfortable position, and document, and go from there. Thank you.